Also addressing scenarios where people can't take the second dose of mRNA vaccines due to allergies, Dr. Janil said they can complete the regimen with the Sinovac vaccine instead and will be considered fully vaccinated. MOH has set up a program for these individuals to get their jabs at public hospitals for closer monitoring. Dr. Janil noted that these people may also opt to wait for the Novavax vaccine, which is expected to arrive by the end of the year.
MOH and HSA are working closely with Novavax to facilitate the regulatory submission for their protein subunit vaccine. The review timeline will depend on the availability and the submission of data by the company to HSA. While we recognize the need to facilitate timely access to the vaccine, there should be no compromise on the scientific rigor of the assessment of their quality, safety, and efficacy. As for the Sinovac vaccine, on the 5th of July 2021, the company submitted to HSA the critical data requested by the agency for PSAR approval. HSA is conducting a careful and thorough review of the data and aims to complete its evaluation before the end of August.
Meanwhile, a review is underway on how short-term pass holders can receive their jabs here. This group includes those who are more vulnerable and have been in Singapore for an extended period due to travel restrictions.
In general, we will apply similar principles, which is around risk and whether the person is at risk in terms of COVID-19. So age is, of course, a consideration there, as well as risk to the people around them, so the settings in which they live, the circumstances in which they find themselves. So there are a variety of considerations that we take into account.
Responding to MP He Tingru's question on the risk level of children under 12 who can't be vaccinated yet, Education Minister Chan Chun Sing reiterated the stringent safe management and surveillance measures in schools. He also said that the expert committee on COVID-19 vaccination is monitoring ongoing trials for this age group and will make recommendations to MOH at the appropriate time.
In Singapore, we have so far observed mild disease in local cases aged under 12 years, even with the Delta variant. We are also fortunate thus far that our children under 12 years old who have been infected, none of them has required ICU nor oxygen. To keep our children safe in the school environment, we implement stringent safe management and surveillance measures and have adjusted the conduct of school activities where necessary. All staff in schools and preschools are required to wear masks. Students in school are also required to wear masks, while in preschool, either masks or face shields are strongly encouraged for children above the age of 2. For masked-off activities in schools, extra safe management measures are taken. For example, physical education classes are conducted outdoors or in well-ventilated venues in small groups based on national guidelines. Mask-off activities are currently suspended in preschools. Preschools and schools also emphasize good personal hygiene and social responsibility. Staff in preschool and schools are also prioritized for vaccination. These measures collectively mitigate the risk of infection in our students.